Hi, and welcome to the InHome Annual Health Assessment. This is the first Medcan webinar in May. I'm Christopher Shulgan. I'm going to work through bios, and then I'm going to hand it over to Shaun Francis. So Shaun Francis is the chairman and CEO of Medcan. He's the chair of True Patriot Love Foundation, the author of the book Eat, Move, Think, and the host of the Eat, Move, Think podcast. Peter Nord is the Chief Medical Officer of Medcan. Before he was at Medcan, he was the VP of Unity Health, and he is the founder of Peter Stillbrook Retirement Residences.
That's it.
That's it. All right. Shaun, I'm going to hand it over to you. And why don't you talk about the circumstances for the InHome Annual Health Assessment, what made it necessary, and then how you transferred everything over in what was actually, a very small amount of time.
Yeah, thanks, Chris, and thanks for our listeners, to our listeners for joining. But Medcan has had virtual visits for quite some time. We're one of the early leaders in this, but as you can imagine, the pandemic has accelerated the pace of adoption. So much so that all of Medcan's back office administrative staff are now work from home, and largely the sick care business, so to speak, is largely virtual, which is fantastic. And our investment, our very major investment in technology over the past few years has facilitated this. And then sadly, our physical annual health assessment at 150 York Street has been shut down during the state of emergency. However, during the pandemic and with the increasing velocity of our sick care business virtually, we started to think about whether or not we could do our annual assessment in home, so to speak. And this is something that's been on the, something that we've thought about for years pre-pandemic. How could you do our assessment more broadly, virtually? And meaning more broadly, beyond the GT, the Greater Toronto area. And the pandemic has just accelerated this thinking, and we actually have now been able to bring to life most of the Medcan experience in home. And I won't take away Dr. Nord's brief, but suffice to say, we do a blood draw and a testing draw, so to speak, at your home. We get all the results, and then it's all followed up with Medcan providers who you can schedule at your convenience in home. And in many ways, as we're thinking about this, so while it lacks the immediate result of imaging and some of the other physical tests that we do, there's other content that we'll be able to bring online eventually remotely that will make the in-home assessment as powerful, maybe more powerful than the in-clinic assessment. So, no time like a crisis to innovate, and that's what we've done. And with that, I'm going to turn it over to Dr. Nord, who can give us more of a briefing on how it actually works.
Oh, Peter,
Thanks, Shaun.
no, we got you. Great.
Yeah, we're back. So fantastic turnaround. I think this is a program, as you mentioned, that was in the works for quite some time as we thought about how to leverage the amazing value that our clients receive with the annual health assessment on site. But then as we start to think about more broadly, could we do something that wasn't bricks and mortar, but still had the same value? And in fact, maybe more value because there's a convenience factor there. And then we heard very early on from our clients that had been booked for their annual health assessment, how long is it going to be? I've got some issues, I've got some medical conditions, what's going to happen to those medical conditions over time? And, how long is this going to go on for? And of course, none of us have the answer to how long is this going to go on for. And we certainly are getting closer to having an answer, but back in March, at the end of February, in middle of March, we just didn't have that answer for people. So what we did though is we said, well, we've been thinking about how to bring the AHA to your home And so in a very short period of time, literally days to a couple of weeks, by the time we literally said go to the time we had our first in-home annual health assessment. And it's because we have an amazing team of people working behind the scenes. We have amazing doctors that are super flexible, the same high quality physician advice that you would expect from Medcan, but it's in the comfort of your own home. And then fortunately, as Shaun said, we had invested over the last 2 years significantly in a complete digital transformation that allowed us the foundational skeleton upon which to build these kind of virtual type products. So really exciting work, and it was not without quite a lot of labor, and there was a lot of 24-hour days there to get this out the door. But we're pretty excited to see the feedback from the clients that have gone through this to date. And so we're a number of weeks into this, and we've been tweaking based on the client feedback. We get that feedback from every single client who's gone through it, and based on feedback, we've actually tweaked and improved it. And as well from our staff, and most importantly, our physicians. So what it basically looks like is initially there's some information gathering. So we call it the prep pack, or the preparatory pack. And that's a data gathering in terms of past medical history. What are your major concerns? What are your lifestyle factors like? Are you smoking? How much are you drinking per week? Family history, review of systems, head to toe. All of that information is collected, and that's done ahead of time. Again, at the client's leisure, on their own pace, filling that out. One of our nurses walks with them through that information gathering process, so that if there's any questions, there's somebody who can literally hold their hand as they walk through that. Because that upfront information is really important to help direct us as we go through the whole process, and specifically with the physician. So once that information is collected, assimilated, it's fed just prior to the appointment to the physician. So the physician has the benefit of reading all that information, kind of going through what's happened in the person's life. If they're an existing client, we roll in information that we have from our information system, our electronic medical record. That all populates in. So we've got a pretty robust picture of what's been happening with that particular person over the last number of years, potentially even decades. So the physician, having all that information, then has an interaction, a virtual interaction with our client in their home, and a very relaxed setting, both for the physician and for the client. And they walk through what the initial sort of thought process is around that. What are the concerns? What are the things we should be looking at? When we have our phlebotomist, our blood draw, what specific tests are we going to do? We have our basic panel. Is there some other tests that the physician would want to have based on that information that's up front? And so that's the next step. Based on all that information, a rough game plan is created. The booking is made for the in-home phlebotomist to come in, and then subsequent to that, virtual nutrition. So it's the whole eat, move, think that we're building into every aspect of this health assessment. So eat, move, think, the nutrition aspect, done with one of our providers virtually, fitness assessment, mental health assessment, especially important during these times where COVID stress is really starting to get on people. We're seeing 50% of our entire population now starting to have some mental health issues as a result of being in isolation, not seeing their loved ones, not seeing their friends, dealing frankly with medical issues that are getting worse day by day, and that weighing on their psyche as well. So putting all that together, blood samples come back to our lab, they get processed, all of that gets rolled together. The physician takes all of that information, has a second visit with the client, again virtually, and reviews all of that. Basically wraps it into some recommendations that can be done, again, virtually. And we're getting very, very close to opening up a lot of our services. The state of emergency next week in Ontario, likely to be lifted. That opens up a range of possibilities for us to do things both on-site and virtually. And so the physician then has a great number of opportunities based on all the information collection to create a plan for that person that's going to carry them through the next year. And certainly if there's any shorter term follow-ups that need to happen, the physician and the nursing team can certainly take care of all of that. Follow-ups as required, and again, as always, each of our physicians is supported by a nursing team, which is one of those key value propositions that Medcan offers. And it makes, frankly, the physician's job quite a lot easier when we have these fantastic nurses, frankly, to help us look good. And so we're happy to have the entire team get mobilized around each patient in their home. And so we're very excited by the project. It's gone extremely well so far. And frankly, even if we get back to being more on-site, this particular offering will remain. There's going to be a number of people living remotely, not easily getting to York and Adelaide, that are going to be able to take advantage of this. It just makes sense. And even some of our folks that are traveling, or frankly, their schedules make it impossible for them to carve out an entire full day to be on site. This opens up some flexibility in their scheduling that they could do that at any point that makes sense for their own particular schedule. So again, no price is wasted. We've really discovered that this is something that is one more thing that Medcan can do to meet the needs of our clients. And especially in a complex time, a very fluid, dynamic, changing time, it's one more thing we can offer and basically go to where the client is, be as client-centric as possible. And if this makes sense for our clients, we should double down on this and continue it going forward.
Peter, do you mind if I ask you, and Shaun, I know you're the one who's going to be asking the questions, but Shaun, how long start to finish? And I guess it takes a little bit about how soon you get the mobile phlebotomist in to do the actual test, but how long start to finish? The actual annual health assessment takes about 5 hours, I think. How long does this take, start to finish?
Yeah, I mean, if you, again, the pieces are relatively similar depending on whether it's a 45-minute consult virtually, with each of the providers, if that goes to an hour, if that's a half an hour. Let's say it was an hour for each of the virtual eat, move, think, there's 3 hours. The blood draw takes minutes. I will say that the time involved with the blood draw is very much around the safety protocols. So every single client is totally protected throughout this. Our staff have complete personal protective equipment on, and that creates a two-way protection both for our client and for our staff as well. When we don't know if there's asymptomatic transmission happening in that particular household, we want to make sure that our staff and frankly our clients are protected. So there's a certain amount of time that's built in for our staff to get the location, get the personal protective on. The blood draw, as typical, takes 5 minutes, and then out of there. So the actual time in the home for the phlebotomy doesn't take much time at all. And then the rest is the pre-visit, the post-visit with the physician. And total time, that's probably another hour. So in terms of total time, you're probably not far off what would happen on site. It's just that it's spread apart, and the total process may take a week if that works for the client. And that's totally flexible on our end. So the chunks would all come together to be around 5 hours, give or take, and probably more like 4 to 5. And that's similar to what would happen on site.
I think it's almost a paradox that how the in-home annual health assessment is so necessary now as something that provides clues to your overall immune function. And I think back to 6 weeks ago, March 15 or so, where a state of emergency happened, and people were worried about catching COVID and worried about their immune function, and then at the same time not able to actually come in for the annual health assessment. And so yeah, I think it was a wonderful thing that this, the Medcan pivoted to create this in-home annual health assessment. Shaun, do you want to handle some questions now for Peter, or do you want me to?
And you're.
Oh, I think Shaun's on. Shaun, are you on?
Oh, I'm on mute too.
No.
The new world of muting and unmuting. How do where do you see the world of in-home assessments going, Peter, as technology evolves? Is there a future where, the physical assessment, we'll look at the physical assessment as something that's quaint, for example, and old-fashioned, versus where the world of the in-home and virtual is going?
Yeah, I think part of the answer to that is if you look at the provincial ministries of health and health authorities, they're actually pushing this now, and they're recommending that whenever you can, for the foreseeable future, not even just for the next month or two, they've been a bit of an awakening for them too, realizing that, this is a convenience, it works, it saves people taking transportation, it saves people, frankly, waiting sometimes for hours in doctors' waiting rooms. So in terms of efficiency, it's a highly efficient way of delivering healthcare. And they're finding out right now that the number of concerns or complaints that they're getting from patients, from clients, and people in the community, citizens, really aren't there. There have been very, very few concerns or complaints. So again, we're moving towards a system that is highly client-centric as opposed to being provider-centric. Our healthcare system was really built around doctors and nurses. What's convenient for the doctor? Well, those days are now gone. We've been moving out of that world, and especially, the age wave, as our baby boomers are aging, they're saying should my time be less valuable than the doctor? And so gradually systems have been moving to become a little bit more client-centric than provider-centric. Medcan's certainly been on the forefront of that, on the leading edge of that for a number of years. But others are starting to come around, and now, as we've seen, and not only are the ministries of health willing to support virtual, they're actually willing to put their money where their mouth is, and that's taxpayer dollars. So up until about 6 weeks ago, doctors couldn't bill for their virtual assessments. You literally had to bill like Ontario Health Insurance Plan, to bill the Ministry of Health in Ontario. A doctor had to physically have to have a person in their office sitting in front of them, make a notation. And that's where the frustration, a lot of, do I have to come in your office? It's just I have this quick little thing. No, you really should come in the office. Well, the reason for that is that doctors, in order to build a system, had to have you there, which is ridiculous. It's a lose-lose for everybody. Now, there are billing codes that doctors can submit for virtual care, and those aren't going to go away. Those are going to continue into the future. So that fact alone is pretty much guaranteed that virtual care is here to stay.
And Peter, where do you think, we obviously do some physical testing, be it the imaging and the 12-lead stress ECG, VO2 max, et cetera. But I know we're also seeing a lot of the science evolve on what we can test for with simply a blood draw. That is highly correlated with some of the results we get from imaging and the ECG. Is that accurate?
Yeah, for sure, we're moving in that direction. Nothing's going to replace, ultrasound, CAT scans. Like that's going to be there in those particular situations. But especially if we're looking at screening as opposed to diving into a specific problem in a great depth, there are a lot of tests, and the one that comes to mind that we were just about to implement when this all hit was something called high sensitivity troponin. And this is a simple blood sample we would incorporate as part of everybody's blood panel as part of the annual health assessment. And it has turned out to be, through a blood test, more predictive of having cardiac issues, heart issues, 10, 15, 20 years later than even a stress test, which is expensive to do, super valuable in certain populations. But do we need to be doing stress tests on everybody? Probably not, and we don't do it on young individuals for that reason. The pickup rate is not there. But even in younger individuals, we have a blood sample that can tell us a tremendous amount of information where previously all we had was diagnostic imaging, things like stress test or cardiolite testing where we have injections and radiation and that sort of thing. So, you want to get the most information you can, as easy as you can, as least expensive, and with the least potential side effects or least invasiveness for our clients. And that's really where we're headed. So yeah, so there's a lot of interesting things that are coming down the pipe in terms of what we can do virtually. And again, it just improves the potential for offering healthcare at a distance. And for many of our clients, we have clients all over the world. But even if you look at the Northern Ontario, we have First Nations communities that are highly remote. So this becomes, for many of them, they would have had to take a plane to get to their doctor. This destroys that business model. It throws it out and it creates an entirely new business model, which is, again, crazy efficient, saves all sorts of time, all sorts of money in terms of the transportation costs, the doctor's time, and ultimately makes for a better outcome because you're able to nip things in the bud as early as possible by leveraging technology.
Yeah, I know that's true too, Peter, of our genetic testing. Again, that's a blood test, and we're moving to whole genome testing. There's obviously some exciting new science on liquid biopsy. So, more and more we'll find, I think, useful reasons to just do the blood draw in an in-home setting.
Yeah, I mean, it's we start to think about Star Trek and some of the stuff that was happening, that was being forecasted, and way back when Star Trek was being created, and we're getting pretty close to that. We're getting pretty close to the tricorder, that kind of thing. So we're getting there bit by bit. And again, the exciting thing about working at Medcan is we're on the leading edge of all that. So it's extremely exciting.
Can I jump in for a question? Because if you look at successful products and the histories of successful products, often what happens is you get the type of soda pop, and then there's a diet variation or a cherry variation or maybe a vanilla variation. And it strikes me that this is an interesting move toward that sort of product segmentation model where you had the annual health assessment, which was so successful. And then, so now we've got the in-home annual health assessment. Are there other areas of business or other forms of product segmentation that you see in future? And I can throw that to either one of you.
Yeah, so we're constantly, I mean, I'll turn it over to Shaun, but for sure, we're constantly looking for new ways to expand. And again, it's been driven very much by clients, where the model that we've developed is to become your total healthcare provider. So any of your healthcare needs, short of an in-hospital stay, like an overnight in-hospital stay, which is almost a failure of the system. Anything short of that, we should be able to deliver. So, Shaun's been there from the beginning. I'm a newcomer, and so he can talk about the history and the whole shift where, Medcan started as that sort of annual health assessment. And now it's grown to become 20 different programs, all encompassing, but ultimately it's listening to the customer and, being very much in touch with client wishes. And a lot of our programs were built around people asking, hey, this has been great. Could you do this? And it's like, yeah, we certainly could do that. And so we're constantly looking to add, expand, get off the bricks and mortar of 150 York Street, and constantly looking to do some market segmentation. But I mean, I think you need to hear from Shaun about, because he really drove that change in the mindset of being kind of the total healthcare provider for a set of clients.
You know, I mean, philosophically, Chris, you know, our roots were primary prevention. And over time, people, of course, who would see the same doctor annually every few years would start to believe that that physician was their primary care provider, when in fact, they technically were not. Though, you know, why go with the flow, so to speak. So over time, we did introduce services where we, in fact, are now the physician for probably the majority of our customers who get the annual physical. And then from there, of course, you have you know, people who have specialty needs. So how does Medcan cater to those on site at 150 York? How do we do it virtually now? And then in addition, coming out of the annual physical, you know, we would tell people, listen, you know, why don't you work out more, get some more sleep, eat more, you know, more healthy, and see you next year. And that was really the gap, which was we wanted to give our clients the toolkit so that it wasn't so much see you next year. We could actually walk with them on this journey to needing us less as their physician on an acute basis and more as a healthcare partner to a wellness basis. And that's, you know, that's where Medcan is going and will continue to go. And it's really endless in terms of what technology and science is now offering us in terms of, you know, how can we improve not just, you know, our longevity, but also our quality of life. And, you know, if we can do this virtually as well, beyond the greater Toronto area as effectively as we're doing it physically, then, you know, it's just the opportunities are boundless.
Fantastic. Peter, did you have any final words to sum up?
Well, yeah, I mean, I think it just sort of plays off of the latest thing that we've been focusing on is our safe at work system. And again, we've heard from corporate clients as much as our private clients that they're really worried about this COVID. And, you know, now we're moving through a stage where we get around the corner, over the hump, and businesses are going to start opening up, and they're really challenged to how to get people back safely to their workspace. And so that's just one more example of developing a product because of a need that's been quite clearly presented to us. And once again, our teams in the space of a couple of weeks have built a program that is quite robust and involves medical advisory, nursing advisory, education, communication, policy development. So even, you know, we have the annual health, but then even on corporate health as well. So focusing on both the private individual clients, but also supporting our corporate clients. And that's almost the primary market segmentation that we look at. We've got our corporate clients, we've got our private clients, and we're meeting all of their needs and trying to turn things around very, very quickly to create a solution for them. So it's a really interesting time for sure. I don't think any of us would have wished to have this thrust upon us. But we have definitely used this time effectively, and now we're optimistically looking at getting back to, not just back to the way things were, but adding what we've built over the last 2 months on top of a portfolio that is already sound, locked in, tried and tested. It's been there for decades, and now we're adding something on top of that, kind of a capstone on top of what we already have to offer. So again, not that it's been a joy over the last couple of months, but I think, you know, when we look back on this 6 months, 12 months, a couple of years from now, we're going to say, wow, it was really worth putting in the effort. And as a result, we've come out stronger than we ever were before.
Thanks for that, Peter. I'm just going to walk at the end of it. We're running out of time. I'd like to walk people through how to learn more about the InHome Annual Health Assessment. So I'm sharing my screen right now. I'm going to go down. So this is the Medcan homepage at medcan.com. And to learn more, you scroll down click on the, we're going to go to the Keeping Communities Healthy page. And if you scroll down a little bit, there's the InHome Annual Health Assessment. You can click on the book now, which takes you to a page with just an absolute ton of information about the InHome Annual Health Assessment. It walks through each of the different components, talks about after your assessment, and then also allows people to find more information as well as book an appointment. And I'm just going to walk over now to so I'm sharing. This is the Medcan Presents webinar series. We do it every Tuesday and Thursday at 12:30. This Thursday, we have sports therapy and rehab Q&A with Dr. Andrew Miners. And then we'll go through the rest of the month as well. So join us every Tuesday and Thursday at 12:30. Shaun, do you want to wrap us up? And I'm going to stop sharing. Great.
Thanks, thanks, Chris, for hosting. Thanks, Dr. Nord. And just invite our clients to tune in. We'll have more of these talking about where Medcan is going, what we're doing for employers, and what we're doing for our clients, both in the new virtual world and hopefully back physically at Medcan very soon.
Amazing. Thanks very much, Dr. Peter Nord, and thanks, Shaun Francis. And, okay, goodbye.
Bye, everyone.